So how is VA TBI rating determined? If you're a veteran and you have suffered a traumatic brain injury and have long-term effects, you might have a TBI rating at the VA. TBI rating can be 0%, 10%, 40%, or 70% depending on the severity of your symptoms, your long-term symptoms. Initially, when you first have your TBI, it will be rated as either mild, moderate, or severe, depending on how long you were unconscious or if you didn't remember the incident, things like that. However, that mild or moderate or severe criteria when the event first happened has nothing to do with your TBI rating. Your TBI rating is determined by the long-term symptoms that you have. Some veterans will suffer a severe TBI and have no long-term symptoms. Other veterans that suffer a mild TBI have severe long-term symptoms such as headaches. So you'll be rated based on the long-term symptoms, the chronic symptoms that you have related to your TBI. TBI ratings are a little complicated because if you have an associated condition such as PTSD from the TBI, you'll be rated based on the rating criteria for PTSD or mental health conditions. You won't be rated based on the TBI schedule of ratings. And you can't have both. If most of your symptoms are the same symptoms described in the mental health rating schedule, you won't have a separate TBI rating and a separate PTSD rating. If you have effects of PTSD that affect your social and occupational functioning, and you have other residual effects of TBI that are not usually associated with mental health problems, such as headaches, you can have two ratings. If you have an associated condition such as PTSD, you still have to show a nexus or a link between your current PTSD and that TBI event. That nexus can be determined by an examiner at the VA, or a private examiner can evaluate you and determine if you had PTSD from a traumatic event that caused a head injury. If you don't have a separate condition that's rated, such as PTSD, that's determined by the TBI event, you will have a TBI rating based on several criteria. Those criteria have to be evaluated by a credentialed provider who is either a neurosurgeon, neurologist, or psychiatrist. For years, the VA provided C&P exams for TBI by the wrong providers that were not credentialed to do neuropsych examinations. If that happened to you, you may have gotten a letter saying you can apply for an increase and be evaluated by the correct provider. I recommend that you do that if you received one of those letters. The three facets of evaluation that's in that DBQ for TBI symptoms are cognitive, how you think, emotional and behavioral, and also physical symptoms, long-term symptoms. You'll be rated based on those facets and basically scored 1, 2, and 3. And based on that scoring, that will determine your rating of either 10%, 40%, 70%. Obviously, if you can't communicate after a traumatic brain injury or something like that, you'll be 100% rated for TBI. Subjective symptoms can also affect your rating. However, those subjective symptoms usually need to be documented by a credentialed provider on a DBQ. You can have those symptoms documented by a credentialed provider yourself, a private provider, and that can be valuable evidence to help you get the correct rating for TBI. However, in my experience, providing a lay statement for those subjective symptoms can be effective, but it usually takes longer appeals, things like that, to be correctly rated based on symptoms, subjective symptoms documented in a lay statement. That doesn't mean you shouldn't do it. It just means, in my experience, if you document those subjective symptoms on a lay statement, you may not initially get the correct rating. You may have to continue to appeal, and eventually the VA will consider that statement and your subjective symptoms, in my experience. So again, if you're a veteran that suffers from a TBI, you will be rated based on the long-term symptoms within the condition that is related to the TBI, such as PTSD, hearing loss, visual disturbances. You'll have a rating based on that condition. If you have other chronic symptoms and you don't have a diagnosis of a mental health problem or something like that, you'll be rated on those facets that I described: cognitive, emotional, physical. Again, if you're a veteran that suffered a TBI and you feel like your rating is too low, unfortunately, you really have to have an exam by one of those credentialed providers, neurologist, psychiatrist, or neurosurgeon, in order to provide the best medical evidence to support a higher rating for your TBI. This can be very difficult for veterans to get. It's expensive to get a private provider to do that exam. The VA is saying they don't accept private DBQs anymore, so you have to basically ask your provider to look at the DBQ and document your symptoms related to those categories on an assessment. It can be very difficult to get. So the best thing to do, in my opinion, is to ask for an increase in your TBI if you feel that you're underrated, and go through the C&P exam for TBI and make sure that you complain about all your long-term symptoms that you have that you didn't have before. So that's basically how TBI is rated at the VA. It's a little bit complicated, but remember, if you have a specific condition like headaches, chronic headaches after traumatic brain injury, you'll be rated based on the headache criteria. You'll be rated based on headaches. You won't be rated specifically for TBI. And you can't have two ratings. If your primary symptoms after traumatic brain injury are headaches, chronic headaches, you'll have a headache rating and you won't have a separate TBI rating. You can, if you have chronic TBI symptoms that are not related to headaches, you can have two. But remember that because of pyramiding rules, the VA, if the symptoms overlap, the VA is not going to give you two separate ratings if the symptoms are the same. So that's a little bit about TBI ratings. I hope this was helpful.
The information contained in this video is informational and not professional advice. Rely on it at your own risk and see a qualified medical or other professional to discuss individual circumstances